The member for Bowman.
Deputy Speaker, on a day when thousands of people will read the Hansard from this date and remember it as the obituary to the Gillard government, it is only appropriate that we also wind up the Indigenous Affairs legislation as a reminder of just how little has been achieved in the last 4 years under both Prime Ministers Gillard and Rudd. Deputy Speaker, this small piece of insignificant, apparently, legislation has a very, very important schedule within it, which we do not support on this side of the chamber. And this is the effort to effectively delegate the appointment of important statutory appointments to the department, and in particular to secretaries and deputy secretaries within the department. And in particular, it refers to the Coordinator General for Remote Indigenous Services. Now, in history, when it is written, we will remember that this government effectively inherited parts of the Northern Territory Emergency Intervention but did very little to build upon it. It was an administration that will be remembered for criticising, when in Central Australia, the lack of consultation, but then when back in mainstream Australia, criticised other elements of it and talked tough. It is a government that will be remembered for not having a consistent position on the intervention and for not being able to follow up and improve some of those investments to ensure that we actually gained results. This will be an administration remembered for not keeping count of the money that is spent in Central Australia, for allowing runaway expenditure in areas of housing. It will be an administration remembered for putting out promises of consultation in 2008 and then on a quiet day in 2011 putting out more consultations to again consult. An administration remembered for making virtually no difference in attendance at school, virtually no difference for community safety. But on the plus side, it will be an administration, Deputy Speaker, remembered for generating an enormous amount of paperwork, for generating an enormous amount of local plans administered by keen and committed officials, but who in the end are thwarted by the failure to take a new look at the challenges of Central Australia. And it was so important today to hear the member for Grey making a valuable contribution about the fact that in the APY lands in particular, things are getting worse. And we will read about it in the mainstream newspapers, and in this chamber we will wring our hands and we will be concerned about the dreadful outcomes. But at the end of our public lives, what will we look back upon, apart from fine speeches on the topic? The question is, what are we going to change? Now, the problem has been identified so many more times than I can count, and we've done reports on what needs to be done so many times. But now, given the chance for some legislative opportunity in this space, we have been presented by this administration with nothing more than the attempt to shift the appointment of significant statutory positions down to the department. And it's hard to understand what drove someone from the current administration to draft such legislation when faced with the squalor and the dysfunction to say, let's design a bill that's actually going to change appointments of independent statutory positions and hand them back to the actual departments they're meant to be monitoring. It's hard to understand that we have an administration that says, let's take that independent Coordinator General and place them in an office right next door to the department officials they're meant to be monitoring, and let their staff be appointed by that very department they're meant to be policing. I mean, the Coordinator General, on the face of it, looked completely reasonable. The job of that person was to monitor and assess and advise on the cutting of red tape, on the efficient delivery of services. I mean, who could argue with that principle? But instead of supporting this position and instead of ensuring that it actually made a practical difference, we're presented with legislation over the last month that devolved and effectively passed on the responsibility to appoint that position to the very department that is meant to be policed. What do you do when that happens? Well, Deputy Speaker, it's obvious. If the person who is monitoring is mixed in with the monitored, then you keep getting more yes people, and you have effectively a neutered Coordinator General. And this area of Indigenous affairs is simply too important to do that. And our time in this place is too short, and our opportunity to change what is happening in most parts of Australia, urban, remote and regional, is too precious to lose. So to simply hand that job back so that effectively, with the greatest of respect, senior departmental officials are picking the person who actually polices them is not good enough, and someone needs to say stop. Let's not do that. Let's keep some responsibility with that minister. And I want to give a few examples tonight of the damage that has been done by weakening the Coordinator-General. Now, it is well known and publicly recorded that the Coordinator-General has written correspondence about the difficulties of that position, both in June 2010, again in frustration in August 2010. And this correspondence is vigorously concealed from public view. When this correspondence is sought, the response is simple. These are working documents that can't be shared. So I just ask, what form of policing of the efforts in Central Australia in particular are so sensitive that they can't be shared with the public? And even you, Deputy Speaker, would have to agree that this information being publicly available is truly, truly important. There is nothing to be gained by hiding the truth. Now, an example of this weakening of the Coordinator-General position is that 6 monthly reports become increasingly diluted and weakened, and we get this almost distant perspective like one's looking through a bus window at the problem. And that fetal alcohol spectrum disorder study called the Lillywand study, phase 2, needs a almost, in governmental terms, insignificant amount of funding to move into its next stage, and the Coordinator-General himself is unable to encourage that to happen. So in the report we just read that this would be a desirable step to be taken, because the Coordinator-General can't say anything more than that. My great concern is that what the Coordinator-General says and writes is actually controlled by the very departments he is writing about. If we move to Queensland, my state, where we see the national priority area of working with communities that need help most, and in the COAG initiatives, every state had to choose communities, we saw 6 chosen in Queensland. It effectively excluded 13 others from that high bar of achieving services in remote communities similar to what you would find in mainstream communities of equivalent size in rural and regional Australia. The Queensland government effectively escaped this entire process by naming 4 communities that were already part of the Cape York initiative. So 4 of the 6 communities were already 2 years into a fairly intensive and well-resourced process. So that was a massive missed opportunity again to give the other 13 communities that desperately need this support an opportunity to be part of this COAG initiative. When we look across at South Australia, the reports are now almost daily in our mainstream newspapers about the dysfunction that has led to breakdowns in community safety, lack of attendance at schools, poor turn-up to health clinics, a failure to improve health outcomes. All of these issues are begging for someone who can truly cut through the red tape, but instead we have someone who is being intertwined, no, bound by that very same red tape. For most of 2011, the Kimberley has been in the spotlight for all of the wrong reasons. It's been a suicide spike, Deputy Speaker, of grave concern. It is reaching the point where there is a suicide every other week, and parts of the Kimberley have descended into a suicide funeral spiral, where no sooner are we leaving a funeral than there is another suicide that's recorded. And the great tragedy of this is the inability of non-health professionals to recognise early those sentinel signs of distress that can lead to suicide. We were promised by this government action, but of course too often the definition of action is a press release, followed by stakeholders desperately trying to divine what exactly the press release means. Typically money is involved, but there is no guarantee when it will ever arrive. So we've been waiting for that suicide prevention money to arrive in the Kimberley. And Deputy Speaker, I have heard almost every excuse known to public service as to why that money is still not there. Let's go through them. The first one is that the framework is sitting on the Minister's desk. The next one is that it's under consideration and it's been already presented by departmental officials, that it's only a sleep or 2 away from being cleared. We've had the Mental Health Commission waiting on additional detail before they would sign off. with money. And in the end, we now learn that this entire 4 or 5 month period since this suicide spike was reported has been devoted, wait for it, to formulate an expert advisory body. As if the public health science of suicide is not already recorded, as if meta-analyses have not been performed, as if we have to turn again and effectively co-opt a new group of experts to analyse this problem all over again when we have impressive, diligent, hard-working Aboriginal medical services and divisions of general practice just waiting for those resources to roll them out. And do you think that the Coordinator-General has been separated enough from the federal departments to be able to make that happen any faster? The answer is no, Deputy Speaker. And that should be the litmus test of the functionality of a Coordinator-General. We have a single opportunity to turn now to the Minister on the other side of this chamber and say the political legacy of these 4 years can be nothing or can be something that generates change. But at the moment, the great lessons learned in Cape York have not been disseminated around the country for no good reason, Deputy Speaker. Sure, we trickle in enough money to keep that study going, but the basic precept of consultation, which we all agree is important, but can never replace action, consultation and an agreement within communities and an agreement within family groups on positive social norms and fund them to occur. We need to look at the Centrelink system and stop potentially making individual payments that lead to perverse outcomes. We need to end the process of paying people whether they send their children to school or not, because this is the rule of law in Australia, and we simply need the methods to ensure that those rules are adhered to in Indigenous communities. They're called local implementation plans, and we have ROCs and GBMs and a range of other departmental officials who make sure that they are completed. And a local implementation plan, when signed off, allows community to define their own priorities, from community safety to health to child safety to environmental health and housing. But most of these haven't even been signed off, Deputy Speaker. We've been waiting for months, and the reason they're not signed off is quite simple. The Coordinator-General can't compel anyone to do it. And these documents have become, commissioned to dusty piles of previous documents that effectively change nothing. The people who are in power in many of these communities have an overriding incentive to leave things pretty much as they are. We see matriarchs who are not empowered, we see children not turning up to school, and the health results are obvious. The first step is a Coordinator-General who is independent of the very departments that he or she monitors. But at the moment, that overview is simply not occurring. My great fear is that we will have, again, 6 months down the track, another diluted, emasculated report from the Coordinator-General that again says, wouldn't it be desirable if this happened? I note that this hasn't happened. Now, that is not a legacy to leave behind to be proud of, but it is already being written. No, it's been carved on the walls of the achievement of this administration. At the end, they will turn to Australia and say, we appointed a Coordinator-General. Look, it was a complex problem and we gave it a red hot go, and every year or two we did a bit more consultation. But in the end, the evidence that they don't care for results in Indigenous Australia, no, they care more for inputs, not outcomes, is that they continue to govern by press release, they continue to send a weakened Coordinator-General into Central and Regional Australia, and they continue to accept reports, raise an eyebrow or two, pick out a good result, and then put that back into a press release. Look, Australia's had enough of papering over the cracks. We've had enough of hiding the reality. Australia's had enough of not telling it how it is. And that's all that Australians would ask of their leaders. Tell it how it is. That won't happen with a Coordinator-General who is in the pocket of the departments that he monitors. It won't happen with a Coordinator-General who is appointed by departmental officials. It won't happen with a Coordinator-General whose staff is actually appointed by the department. For goodness sake, there should be no fear in this country, with the lessons we haven't learned in Indigenous health, to have a truly independent Coordinator-General. We don't have it if this Schedule 2 is passed, and that's why this side of the chamber will fight vigorously to make sure that the appointment of a Coordinator General remains with the Minister. That is exactly where it belongs.